Hello, dear friends. Today's topic is premature ejaculation. I will not describe that this problem destroys a lot of relationships. Those who are familiar with it perfectly understand what it is about. What is the definition of premature ejaculation? It's not minutes and seconds, but a subjective indicator when one of the partners, a man or a woman, is not satisfied with the duration of the sexual act. Well, on the one hand, of course, it is impossible to argue that premature semen retention is when a woman, for example, experiences orgasm after 25 minutes of sexual intercourse, and a poor man can only last 20 minutes. This is not premature sexual intercourse. On the other hand, there are cases when ejaculation happens even before the beginning of sexual intercourse, and then it becomes problematic even to get pregnant from such a man because he simply cannot get the sperm to the right place. From a physiological standpoint, there is nothing inherently wrong with premature ejaculation. On the contrary, men who experience ejaculation quickly may even have certain advantages. During sexual intercourse, men are clearly vulnerable to potential opponents, making them more easily separated from their partner, or worse, killed. Therefore, from an evolutionary perspective, those individuals whose ejaculation process happens quickly have an advantage. They can efficiently fertilize, reproduce, and, most importantly, avoid harm. However, in modern society, this approach is, of course, unacceptable, and many people suffer because of it. What, then, causes premature ejaculation? We cannot identify any significant physiological abnormalities here. Yes, in some men, there is a correlation with chronic prostatitis, specifically its variant known as chronic pelvic pain syndrome. Additionally, premature ejaculation may sometimes be an early symptom of erectile dysfunction, commonly referred to as impotence. It is not necessary. That is, not all men with early semen expulsion suffer from prostatitis, or they, for example, have a weak potential. Absolutely not. It can be just. And therefore, from here, attempts to many urologists are trying to cure a man from what is not there. Diagnose with prostatitis. For a long time and unsuccessfully, torture with massages, various injections, candles, and other physiotherapy procedures. And the case stretches for decades, for a lot of money, for a lot of nerves. But there are no results. The family and relationships are collapsing. The same story with erectile dysfunction, but it has its own solution, which I have a separate video about. What does modern medicine offer us? Well, there are several approaches, as always. The first approach is psychotherapy. But psychotherapy is tied, of course, to the personality of a psychotherapist, who may also have his own cockroaches in his head. Go try to find the right psychotherapist, and there is no guarantee yet that he can help you. The second option is the use of drugs called antidepressants. Antidepressants are also a thing, not always. Transcripts provided by Transcription Outsourcing, LLC, is an inhibitor of the reverse seizure of serotonin, a super-fast action. Its action develops literally an hour after the reception, and indeed, this drug can prolong the sexual act. But practice shows that the use of duloxetine has multiple side effects, and 90% of men who have tried it refuse to use duloxetine. In addition to drugs, it uses special condoms, gels, lubricants, which contain lidocaine. Lidocaine or any other anesthetic simply attacks sensitivity. But this is not always a way out, and it does not work for everyone. What remains? Remains a very simple, effective, cheap, that is, not that cheap, but a free method, which was invented in the late 1950s by good people. The names of these good people are Virginia Johnson and William Masters. They came up with a technique that allows a man to learn to control ejaculation time. That is, a man is able to recognize the time X and artificially pull it back as much as it is necessary for him or for the woman. How does this technique work? It can be performed either literally, or with the help of a partner. I will also explain this method in detail in the description of this video, so after I say it, Help of a partner. I will also explain this method in detail in the description of this video, so after I say it, you can open it below the text after the video and read it again. So, the first thing to do is to feel the place on the organ, which is located below the nipple, below the head. And just try to grab it with your index and thumb first. This is the first point. The second point is that after you have identified this place, you need to begin to, God forgive me, to excite. After the stimulate has been achieved, you need to continue to stimulate yourself until the time of semen excretion comes. As soon as this time comes, as soon as the man feels it, you should immediately stop, stimulate, and squeeze quite tightly with your fingers below the head, in the place where you have already felt it. And give about 30 seconds or exactly as much time as it takes for the call to ejaculation to disappear. That is, so that you don't want anything again. Repeat the same procedure 4 or 5 times. And it should be done regularly. For some, it is enough to do it once. For some, it is enough to do it several times. But the efficiency of this technique is about 85%. Well, Virginia Johnson and William Masters have developed such a simple and accessible technique. We just have to use it correctly and everything will be fine. Of course, in addition to this technique, there are other options for such behavioral treatment. It can also be a Kegel exercise for men. Well, this technique is the simplest. It's ancient, since it's been around since the late 50s. It's already free, as I said. Why not use it? All for your attention. Have a great mood and wonderful interpersonal relations. So after I say it, you can open it below the text after the video and read it again.